in liver abscess, in this condition called liver abscess, you have pus in some portion of the liver. It can be a single abscess or it can be multiple abscesses. The reasons for the liver abscesses are varied. It depends on various factors. It depends on various diseases, background diseases you have. So the most common liver abscess is due to a condition which is called amoebic liver abscess. So, there is a parasite living in our intestine which is called entamoeba histolytica. So it's basically a parasite which eats your blood vessels, eats your blood cells, and eats the intestinal mucosa inside your body. Many of these infections are asymptomatic, that the patient will have some loose motions for some days and then it will go. Patients who are alcoholic, patients who are young, patients who are immune compromised. So these parasites, they enter your intestine, and from your intestine they gain entry into your liver, and then they start eating the liver tissue. And as a response to that infection, your body fights with that organism, and you end up with a liver abscess. So this is one of the most common causes of liver abscess. Then liver abscess can be a manifestation of many other diseases. Say some patients have stones in their gallbladder, and those gallbladder stones end up getting into the bile duct. So there is a system in our body where you have the liver is secreting bile, the bile is coming into the bile duct, and the bile is getting into the intestine. So if there is a obstruction to the bile flow because of any reasons, it can be because of stones, it can be because of worms, it can be because of cancer, it can be because of any stricture in the bile duct. So there is liver abscesses because of the obstruction. So because of obstruction, because of infection, because of severe infection in anywhere else in your body, that also can lead to a patient having liver abscess. So liver abscess is pus in the liver. Most patients with liver abscess will come to us with a history of uh, you know fever, pain in abdomen. So patients will have high grade fevers, patient will have pain in the right side of the abdomen. Patients can also have loose motions associated with this fever. In later stages, if the abscesses are big, gradually the abscess is becoming big and big. So patients will have jaundice, patients can have vomitings. In very rare cases, these abscesses can rupture, so they can burst open. So the pus comes out into your abdomen, and then it starts affecting. So the patient will have abdominal then the patient becomes very toxic, and then at times the patient can land up with surgery. Once you have diagnosed the patient of a liver abscess, the treating clinician will first of all have get you will have to get a sonography of the abdomen or a CT scan and some blood test to just confirm the severity of the disease and the diagnosis. And usually these patients will be started on some oral antibiotics or injectable antibiotics. So that is the first line of treatment. Most of the patients will get okay with this antibiotic treatment. Some of these patients whose abscesses are large, whose abscesses are about to rupture into your lungs or into your heart or into your abdomen, these patients might require drainage. So drainage may, what we do is we put a pipe into your abscess cavity, uh, and that pipe removes most of the pus out of your liver. That reduces the septic load inside your body, and then the antibiotics play a role. Rarely, in some patients in whom the liver abscess has ruptured and the patient is having severe complications, in these patients, the patient may require surgery. So usually the surgery nowadays is done by laparoscopy. So you just make 3 or 4 holes in the patient's abdomen, and then the instruments, the telescope is put inside. You see everything. You wash, you clean up the abdomen, and then you come out. Or at times you need to open the abdomen, clean everything, and then do. So these are this is the grading of the disease and the required interventions. Most common complication is dysfunction of the liver. Usually all liver abscess patients will have some minor degree of dysfunction. But then if the abscess is big, if it is left untreated, if it is inadequately treated, the patients will land up with complications, something like this. So the abscess can rupture into any of the neighboring organs. So the abscess can rupture into the abdomen, the abscess can rupture into your intestine, abscesses can rupture into the lungs, into the pleura, and rarely even into the heart. So liver is closely associated with all these organs. So if the abscess ruptures into the heart, it can lead to death of the patient. If you have a illness, if you have loose motions, occasional abdominal pain or mild abdominal pain for 2 days, 3 days, 4 days, that is these are some symptoms which should not alarm you. But if you are having high grade fever, if you are having severe abdominal pain, if you are having severe pain while you are coughing or while you are taking a deep breath, or if you notice jaundice, if you see yellow colored urine, if you see yellow colored eyes, if you have vomitings, if you are not able to eat properly, these are some of the symptoms which should prompt you to take early medical advice. The most common risk factor is alcohol. Then you have uh, immunocompromised patients who are diabetics, who are on some chemotherapeutic treatment for other cancers, patients who uh, are known to have gallbladder stones and they are taking alternative therapy. These stones land up into the bile duct and you get complications and then liver abscesses, which are called choledolytic abscesses. So these are some of the risk factors for liver abscesses, and usually males. So males are usually affected, females are spared. The most important liver abscess prevention is hygiene. If you eat food which is not contaminated, because this organism gains entry into your digestive tract through your food and water. So if that is taken care of, so this infection can be prevented. So hygiene is one thing. The next thing is reduction in the consumption of alcohol, because alcohol plays an important role in amoebic liver abscess. And then according to the cause, the prevention can be thought about.